You have to have the will, the want. You have to be hungry to do this. You have to be excited being in the OR. You have to be excited being able to. All right, so welcome back again to ND Speaks TV. This is Dr. Robin. As we discussed earlier in the introduction, that we'll be doing some anesthesia topics related to anesthesia, and today we just wanted to have a little bit overview on different people in the mostly in the medical profession, either being the MD, being a medical doctor, or being having your doctorate in the nursing profession. There are different routes that you can use to go into anesthesia practice, and so that's what we want to talk about. The different routes to go into anesthesia practice, number one, and then secondly, is going to anesthesia practice for you, because there are a lot of pressures that you will have a lot of pressure that abound. And so we got to make sure, or you got to make sure, that this is something that you want to do, or that this is something that you can do, because every profession does not fit into everybody does not fit into every profession, or every profession does not fit into everybody. So so we want to make sure, you want to make sure before you do this, if it is something that is cut out for you to do. So firstly, we are going to talk about mainly what would we say the anesthesia practice is. A lot of people understand this as, patients, coming for a procedure, put you to sleep, wake up. It sounds easy and straightforward. But there's a lot of other things that have to go into that. You have practitioners, be it the anesthesiologist, or be it a DNAP, a doctor of nurse and anesthesia practitioner, or it's also called a nurse anesthetist, or you can also say a certified registered nurse anesthetist. So be it that you have them involved in preoperative care, intraoperative care, postoperative care, recovering the patient, understanding the patient's history and physical, and being able to use that to tailor, more or less, more so tailor an anesthesia approach that fits the patient. So it's not just putting the patient to sleep and waking up, but also it has to do with a holistic plan of care to have a good outcome for the patient. And so in saying that, we would want to talk about the route that you can get into becoming an anesthesia provider. First, you have the nursing route, and then you also have the physician MD route. Nursing route, you will first of all get your 4-year degree as a registered nurse. And you have a special skill set you would need for that, which is going into critical care, intensive care unit or critical care. You have this surgical intensive care unit. You have the trauma intensive care unit. You have the cardiovascular intensive care unit. You have the neuro intensive care unit. You have the pediatric intensive care unit. So you have a lot of intensive care units that you need to work in. You should be working here for about an average of, I think some places are accepting 1.5 2 years, but an average of 2 years is, I would say, is optimum. And after then, you would need to apply to an anesthesia program, which you will get your certified registered nurse anesthetist license, which is also a doctorate in nurse anesthesia practice. And so you will do that. There are some places that are probably still doing master's program for 2 years, but now the main thing now is the doctoral program, which you will get your doctorate in nurse anesthesia practice. And certified registered nurse anesthetist. That's how you get that certification after you take your exams and get your license, and that's how you practice in that. And so that is the nursing route. So a lot of people want to do a lot of things. A lot of people want to go into a lot of fields, but you have to ask yourself, is this for you? Is this what you want to do? And so that's what I call the decision time, because you might think things look easy and you can just get in and do it. But sometimes when you actually do it, you will realize that a lot of things are more difficult to do, and there's a lot of planning that needs to go in place before you can do it successfully. If you don't plan well, then what happens is that you will, or you might have some hiccups while doing it because you did not plan for those things. And so what I like to tell people is factors to consider, right? While making that plan, if this is for you, what are the things you should think about? What are the things you should think about while making the plan if going to CRNS school or getting your doctorate in nurse anesthesia practice? What should you be thinking about if this is for you? And so I like to group this in a couple of subheadings. Number one would be, are you married or are you single? Do you have kids, or do you have family that depend on you? Because this has a lot to do in you being successful in doing this. Second is the age, right? Second is the age. Remember, if you are older, I like to create 3 age brackets for this. You have the 25 to 30 group. Of course, you'll be in college probably by 1920, get done about 22, 23. So, and you'll work in the ICU for about 2 years. So put you around 25 to start anesthesia school if you're going in there, brand new, fresh, young. 25 to 30 group, that's a sweet spot. Sweet spot, you probably not married, don't have anybody depending on you. So if you can do it, if anybody can do it, that age group right there, if you're right there and you're like, this is what I want to do, and you're right there, you need to do it like today. And you need to do it today. That's what I tell people. The next age bracket is about 30 to 35. That's when you start having a lot of, you have some responsibilities. Some people are married, some people are not. Some people have kids, some people are not. Some people don't. But your kids are probably still young, but that is that group that I say you're in between, right? If you want to do it, you go ahead and do it, right? Because your kids are younger, you probably could still, manage things and manage family and all that. And then the next age group, I call it the 35 to 40, is where kids probably maybe a little older if you had kids, probably a little older if not. But this is a group that might be challenging, but it is doable. Full disclosure, that's what I fell into. But I knew that this is what I want to do. Now, when you get to that point where you have things that, circumstances that you say, wow, this might be tough, that's when your willpower comes in. So the next thing I want to talk about that affects the decision making is the passion for this, right? If you have passion to go into a postgraduate education like an anesthesia program, that's it. If you have the passion, if you have the drive, there is nothing that can stand in your way. And you have to have the love of doing this. You have to have the will, the want. You have to be hungry to do this. You have to be excited being in the OR. You have to be excited being able to go through a procedure with a patient and be like, yes, you have to picture that, right? You have to kind of picture that. You have to say, wow, this is what I want to do. I'm excited about this. And so when you have that passion and excitement is all over you, then there's nothing can stop you really. Like you could be 50 or 100, you'll do it. Because that's what you want to do. So that should probably actually be the first thing that you should consider. Do you have the passion to do it? Because I know a lot of people say that if you love what you're doing, you will never work a day in your life, right? Because you will just go to work doing what you love to do. So if you have the passion, then, right, do you have that passion enough to take you through what you want to do, if you have the passion, you are able to go through this with ease, even if with a lot of things that are challenging. The passion is going to get you through it. Okay. And then the third thing is your partner. Now, if you fall into that first group that you're, if you're single, you're making this decision by yourself. You're like, I'm going to wherever. I can apply to an anesthesia program wherever. I'm going to go to Arizona and do it. I don't care where it's at. I'm going, right? But if you are if you're married, all right, and then that decision, unfortunately, will not be yours alone, because for you to be able to do this, your partner has to be 110% on board, because it's going to be as stressful as on them as it is going to be as stressful on you. Okay, because you're not going to have time to hang out. You're not going to have time to be the most caring person in the world. You're going to be very selfish during during that time period. You're going to only worry about how to pass that next exams, how to make it out of clinicals. There are going to be moments you're going to be emotional. There are going to be moments you're going to cry. But if you have a strong partner, then, right, you're able to do this very easily. So, are you single or are you married, right? Do you have a partner? Is your partner on board? It's got to be an open conversation. If your partner is not on board, it might be a little tough, but you can still do it, but it might be a little tough. So you have to make sure your partner is on board, is what I'm saying. Or it might be a little tough. Then you have to consider your bills, right? And this we're still talking about decision time. You have to be able to take all this into perspective when you're planning to make this decision, right? So your bills, you're not going to be able to go to school for 3 years, or to go to work for 3 years. I have not worked in 3 years. I did not work for 3 years while I was in school. And there comes the partner, right? If you have a strong partner, my wife, full disclosure, Indy Speaks TV. She is a nurse practitioner, does well. And so I had that support. And so you want to make sure you have someone that is on board, that you can have that support. So that's where you have to have that open discussion with your partner. And then you talk about the bills. What's the bills going to be like for 3 years? Can I pay the bills for 3 years? Can I afford to stay off of work for 3 years? Still got mortgages to pay. You still got phone bill, light bill, water bill. You still got to pay those bills. Those bills are not on vacation. They're not in school. They're coming. So how are you going to do that? That's a conversation you have with your partner. And then that's where you say, okay, how do I plan to facilitate all these things, all these engines, right? That they keep turning while I'm in school. So can you afford to be off for 3 years? Some people attempt and try to work during this program. I must tell you, CRNA school or anesthesia school, it's very tough to do it while working, because you're going to be in clinicals 45 days during the week. You have exams every week. In my program, at least, you have exams every week. And so you need to be able to study over the weekend. So if you go to work over the weekend, some people have done it, but the people that have done it are fewer than the people that have not done it. And if you want to succeed, some people have attempted to cross that bridge, but they've not been able to either, because they didn't make it, because they went to work. So you have to understand, is this what you want to do? Can I stay off for 3 years? Or if I decide to work during that period, you need to have your brain needs to be kicking at 1,000 miles an hour to grab things in 10 seconds. And so another thing is, do you have people depending on your income? Put that in context too. Are you still going to be able to take care of whoever is depending on your income during that period of time? There goes again, partner. And also making plan. You have to plan ahead, because you can plan ahead to take off those things, right? While you're in school for 3 years, right? And then Other things is, can you pay off your debt before you start? If you have debt to pay off, can you pay off your car note? Can you pay off your credit card bills? Hey, can you pay off your mortgage for 3 years? You know, what can you do? Can you pay your rent for 3 years and just be like, that's in the back pocket? Because there are more things you can handle while you're not in school financially. It reduces your the amount of money you get from student loan, because student loan, they'll give you all this money for living expenses and this and the other one, but the fact is you still owing that money. When you're done, you have to pay it back. So now that leads us to making that decision, is bring all these things in context. And what I did is I had a 5-year plan of doing all these things and becoming a CRNA, or becoming a doctor of nurse anesthesia practice in 5 years. Meaning, I needed to plan how I'm going to be okay for the next 3 years, for the 3 years that I'm going to be in school. So I needed to make some investments. I needed to do a couple of things that will facilitate that. I needed to make some plan. So in the next video, what we're going to talk about is going to be how my own idea, my own 5-year timeline plan that I did personally, this is mine, that I did to facilitate me successfully going to school. Like, I went to school for 3 years, and a lot of my friends were like, you went to school? You don't even look like you went to school. It was the plan, right? It was the plan. They said, you went to school. You didn't call us one day to ask for gas money. You didn't work. It was the plan. So what we're going to talk about in the next video is, right, that 5-year plan that I put in place from becoming a registered nurse to becoming a CRNA with ease. From becoming a registered nurse, your first year as a registered nurse, right? After you've become a registered nurse, first year, from that point to becoming a CRNA in 5 years. That was my plan. I'm doing it with ease. I'm being able to take off debt, take off things before you do it. All right? That was my plan. And so we're going to talk about that in the next video. Again, this is Dr. Robin, CRNA. Thanks for tuning in, and see you next time. Can't wait. Tune in.
All right, thank you guys for joining us today. We hope that you did love this video. Drop a comment, drop a heart emoji. Let us know if you love it and if you want more to come. We have so much more planned for you guys, so much more. All right, until our next video, see ya, adios.